Just get to that. So, so in my papers that starts on paper 6. So any inaccuracies on the page 6, 7, 8, 9, 10, 11 and 12. No, okay. And I think we had one question from the public. Sorry, let me just get this up on my screen.
Anne Daly is here if you'd like to put your question, Mr. Daly.
Thank you. My name's Anne Daly. The question is, we welcome the founding of a recovery college in Wokingham and the council's far-sightedness in thus providing such a wide range of support and information to those recovering from poor mental health. And we'd like to know how the council plans to inform as many residents as possible that they are eligible to attend courses which are free at the moment at the recovery college.
Thank you. So Charles has drafted the answer for me. So the Recovery College is available for Wokingham residents over the age of 18 years. The courses are currently online until it's safe to use community venues to deliver courses face-to-face. In terms of advertising, the courses and promotion of the Recovery College were made contact and shared information with several local individuals and organisations, including Citizens Voice, Sports in Mind, Unlock Your Wellbeing, Berkshire West Your Way, 2 Vida, Compass, Depression Expression, which peer support group, Optalis Supported Employment Service, Health Watch and the CCG. The Recovery College team has worked with the communication team for Wokingham Borough Council. There has been news release on the Recovery College and this is being followed up by social media posts. The team are also working on a case study of a student who has used the college to share their experience. The service was promoted in a CCG newsletter. The project was also promoted in newsletters by Involved and 2 Vida. If residents use Google search to search for the Recovery College, it now comes up first. There is also a new prospectus available shortly listing the courses, and this will appear under the mental health section on Wokingham Borough Council website.
Thank you.
Thank you for your question. Do we have any questions from the members, Madeleine?
Sorry, Chair. Just need to check whether Ms. Daly has a supplementary question.
Is that okay? Thank you.
Yes.
I just wondered if there's any plans for partnership working with, say, the CMHT in the future, and community navigators, so maybe direct referrals with patients' consent to the Recovery College.
I said the health side of things. So certainly with the social prescribers, they work really closely with the voluntary services to know what's out there. So they are a great resource of diverting people to these courses direct. And there's also a pilot happening in Wokingham West Plus, which is covering the Brookside, Chalfont, Lower Early area, where the unitaries are working with GP practices to refer these patients into those services as well. And CMHT are really good about looking at these resources and using the voluntary sector and education in every way possible. So I'd like to think we have got it covered. Yes.
Thank you very much.
Thank you. So sorry about that. So any questions from members?
No, Chair.
Thank you. And COVID update?
Thank you, Chair. It's Ingrid. I'll be taking on that agenda item. So I'm just going to share my screen to show you our latest COVID update on the Berkshire Public Health website, which gives a daily live update on COVID figures. So today we've had 39 new cases in Wokingham, and that sees us with a rate rising at the moment. At the last available one is from up until the 5th of December, and that's at 142. So you'll be able to see here in this graph that we were rising at the period when we went into lockdown, and our lockdown effect brought us back down into a plateau. But since the end of lockdown, we have started seeing our cases creep back up again. We are able, by clicking these buttons, to overlay both the national picture and indeed the picture from the southeast. We are echoing the picture from the southeast, the orange line, and actually for the first time in a very long time, the southeast rate has exceeded that of the national rate. So that is obviously a concern which involves Wokingham. In terms of our daily number of cases at around 39, we would not be expecting to see this weekly rate fall. We are expecting it to see it rise slightly and hopefully plateau, but at a slightly higher level. So that's, if everyone's happy with that COVID update, that's an update from our... Thank you very much. And I think you're also doing the strategy into action. I am. So this is a really a brief update for the board. As you're all aware, this is a piece of work in progress, and I'll give you see the papers in front of you. So we have the board agreed to us setting up action groups around each of the 3 wellbeing priorities, and over the past couple of months we've been proceeding with that at pace. What they are doing is coming together with partners across this broad spectrum of activity related to that wellbeing board priority, and trying to capture all of the activity going on that is perhaps at the moment not captured, but also encourage collaboration and devise a more systematic and effective reporting route into the wellbeing board, capturing all of that activity that's going on at the moment. So obviously there are 3 of those groups. The first is the physically active communities group. We proposed a timeline to the board, I think 3 or 4 months ago, and we are very much on track. That group met for the first time this week. It was a very lively, engaged meeting. I was there. That group is chaired by the sports and leisure team and co-chaired with public health. It has broad representation, the list of which is on page 7 of our paper or presentation. And already we have seen, that meeting was on Tuesday, and we've already seen emails through about various reports that might otherwise have been lost. For example, at Dinton Pastures, they've just taken part in a national evaluation around the effect of sailing on children's educational attainment. Wow. So, and that report has come through, and I think we might otherwise have lost that effect of that activity. So already we're seeing some of that benefit in the first week, but we also could see in that meeting, as people were discussing, seeing where there were gaps in knowledge about partners' work, and where there was overlap and potential collaboration, and also with the beginnings of how a reporting structure might come together. So that was really positive. The second action group is on reducing social isolation. This is a slightly trickier action group, as you might imagine, in that the reporting outcomes are not quite as clear as in the sport and leisure, in the physically active communities. So we co-chair that with Phil Cook from Involve. He co-chairs that with Public Health, and we had again the initial meeting of that group this week, and once again a similar result. We had groups, all the relevant partners, although please, if you look at the presentation and feel people are missing, you must let me know. And that again found areas of overlap, potentially areas of gaps in terms of reach, in terms of social isolation. This group has perhaps the largest piece of work to do around identifying the current landscape of social isolation and loneliness, and indeed where we might make the most progress with the work that we're doing. But they have had their initial meeting, and the next meeting is planned for January. And the last one is around narrowing health inequalities. That group is being co-chaired by Children's Services and Public Health, and they are due to meet in January, which is along the timetable that was agreed by the board a couple of months ago. The group has been, the members of the group have been identified, and that meeting is currently being booked for the second week of January. So I think that there's been good progress to date. Partners seem engaged, and our job now is to build upon the foundations that we've set up, and particularly around identifying the activity and reporting that in an effective way into the board and into other partners as well. So that's that for that item, but I see there's a question.
I can't see any hands, so shout out if you've got any questions.
I've got a hand up. I've got a hand up, yeah.
Go on, go ahead, David, thank you.
Thank you. I just wondered, this social isolation, and I know I go on about them, but the link does an awful lot for loneliness and so on. Is that included in that board? Because I think there'd be a very valuable voluntary sector input. And I think, you know, they could grow, and certainly Matt Pope's got a lot of time for them as well.
Yes, no, absolutely. So I think I'd have to get back to you with specifics unless Phil Cook's on the line, David. But as far as I'm aware, the link is indeed feeding into that social isolation. Martin's got his hand up, so he might know that more specifically.
Yeah, I was just going to say, obviously, Phil Cook is on the group, and Phil basically chairs the Friendship Alliance, and the Friendship Alliance is a cohort of the Link, Age UK, Wokingham Volunteer Centre and Involve, and their focus is on tackling social isolation. So that is very clearly linked into this group, and you know, we are doing a lot of work with the Link, especially on social isolation.
Thanks.
And I just had two questions. One on the social isolation. I presume we're linking in with the social prescribers working in primary care, because obviously they've been doing, you know, calls throughout kind of COVID to those patients as well. But also the narrowing the health inequalities. Again, I presume you have got primary care or, you know, BHFT and health on those calls. Fabulous.
Yeah, we do, Debbie, yeah.
Brilliant. Thank you very much. Any other questions? John, I saw your hand momentarily went up. Was there a question, or have you decided against it?
I was just going to say we do have a panoply of actions at the moment for social isolation, one of which is the Link phoning sub scheme, of which I am part, and so it is already in place to a certain extent.
That's great to hear. Thank you, John. So if there's no other questions, we'll go on to the Working Integrated Partnerships update. Lewis, are you taking this one? Or Katie?
Yes, I can take that, it's not a problem.
Thank you very much.
Good afternoon, everybody. So just a brief update here around where we stand with our integrated partnership. It's going to focus on our response to the winter, essentially, and our COVID winter plan. So this year has been very challenging for the whole country, especially those in health and social care. Upcoming winter has required the local authority and our partners to develop several winter plans. Three of the key ones of this are around the Better Care Fund Winter Pressures plan, the COVID Adult Social Care plan, are the two. So we submitted our plans on time to the Department of Health and Social Care, and the plan was developed as a whole system of various different means. Following the process, the good news is that the system partners feel that generally we're well prepared and organised to meet all of our key areas of the plan. And the plans have resulted in extra services being worked and developed with teams around the health and social care system to be expanded. So just to highlight a few of those that we will be expanding, growing, etc. So there's currently a voluntary community sector mental health pilot, which is recently started due to an increase using our population health management approach. We've noted there's an increase in the number of people that are reporting issues with their mental health as a result of COVID, etc. So the pilot started with our colleagues at their Citizens Advice Bureau, offering support to people to deal with some of the causes of their mental health issues. So, for instance, this might be debt advice, housing, benefits, that sort of thing, but also offering onward referral to other voluntary sector organisations, including a specialist mental health voluntary sector organisation. PHM, as previously described, population health management, is offered us many useful insights during the pandemic so far, and they've been gleaned from the work of the analysts around the system and putting together data from multiple partners. For us, this has been huge and enabled us to do a lot of work to reach people in the community. So this population health management approach is used to guide all of our locally, all of our projects, and is used as best practice with the rest of the systems in the country. So that's been really great. With that in mind, we've decided that we're going to employ a PHM, population health management analyst, to support us with this work for cohorting of multidisciplinary teams and supporting our projects within the plan, Better Care Fund programme to be led by a PHM approach. We're also looking to have primary care network social workers, so support an increase in the frequency of multidisciplinary team meetings, increase our social work presence, which will allow our PCN leaders to have a go-to person for support with social care issues or questions, allow for regular meetings with social prescribers in the voluntary sector, and of course our primary care network leaders. This will also support our partnership to achieve one of its priorities around primary care network development and also around integrated care network development. The increased geriatrician support has been purchased from our colleagues over at the Berkshire Health Foundation Trust, and they're now offering an enhanced service with 4 days cover. So far, during the second wave, the support of extra geriatrician has been absolutely vital, and it is allowing for hospital-type treatments, including the use of oxygen and dexamethasone, apologies if I said that wrong, which will allow COVID-positive patients with compromised respiratory function to remain in their place of residence. It's also allowing for more access for geriatricians to multidisciplinary team meetings. There's a small number of people which are delayed from leaving hospitals or end up becoming a non-elective because they may have a need for medication-only care calls, so we're choosing to fund that as well. Speaking of Involve with Phil, we have a cancer champion scheme which we're going to continue to fund. Involve has developed a holistic model which provides a framework to support people affected by cancer, and that includes those with the disease and their carers who often feel overlooked, and it includes all people with all types of cancer. We're also looking to increase the level of staffing that we have. Extra occupational therapists and social workers are being hired currently to fulfil the roles. We're extending our home from hospital service to now be 7 days and increase the number of hours that it operations and also the duration of the support which is offered to the people using the service. And to ensure that we have places to take people from hospital, we've started the block booking process for home care and beds in the borough. And finally, we have increased our infection control nursing within the area. Obviously, during the first wave, it was established very quickly that care providers in the community, both those that support people in care homes and with home care, would benefit from further infection control nursing support. So across the west of Berkshire, we've got together to ensure that that's the case. Thank you very much.
Thank you, Lewis. David.
Sorry, I keep on having questions. I saw today in Oxfordshire Mind an advert for a primary care wellbeing project manager for Wokingham. Is that to help with our mental health and our well-being? And is that the kind of people who we're using to support those who have things like anxiety and stress?
Absolutely, sir. They're linked to this project, I imagine.
And I presume that's a new post.
That's correct, sir. Yes.
Thank you.
Martin.
Right, yeah, David. So we're doing two things. So we're doing this mental health pilot in the early plus area, which Lewis referred to. But then also we went out to tender to fund a VCS partner with mental health experience, and we have appointed Oxfordshire Mind. So that appointment is the start of that. So we're hoping to have a team in place hopefully by the end of February. and they will link very closely in with primary care and with other VCS partners, so that we skill up the total voluntary sector, as well as having some skilled VCS support for mental health.
Thank you.
Katie, I will get to you, but I just want to come in on that. I mean, I think it's amazing the amount of work that we are covering as a system throughout Wokingham, and really holistic, looking at patients, stopping patients going in, supporting them, also when they're coming out, making sure they are safe and feel secure when they get home. But isn't it great that we're talking about mental health equivalent to physical health, and just putting in those steps to move towards that? So I think it's fabulous. I did a PPG meeting for all of the PPGs and the practices through Wokingham last week, talking about some of this work as well as the urgent care work. And I think they were just staggered about what we are achieving, despite the situation we are in nationally. So well done everybody really for making this happen. Katie.
Yeah, I was going to build on what you said there, Debbie. I think actually it has been a mixture of, we've got a very good working relationship that has been built up since the birth of the Health and Wellbeing Board. So the Health and Wellbeing Board have got to celebrate this, because without your support, actually, I don't think we'd be in the position that we are in at the moment. We've got the right infrastructure, we've got the right relationships now established across the whole of the health, social care, community environment. And actually, they are working as one. And I think that's a one-team approach that has really made that significant difference. Thirdly, everybody has embraced my actual, my passion, population health management. I think that's the best way to describe it. And actually, you can now see the real benefits of this methodology and this tool. And actually, you can see how you can utilise data. You can see how you can actually stratify patients and really make that difference and target it towards people with certain traits. And it's making such a big difference. The final thing I would say is, I'm very conscious at the moment, we've been talking quite heavily about adults and frail people. We've got a massive gap, I think, in relation to children and young people. And we've now got to start to take that conversation through into the children and young people arena. So I'm going to start working quite closely, hopefully in the next year, with Nikki Cartwright, who is the Director for Joint Commissioning. But I also want to work with the Directors of Children's Services to share the learning that we've done in the adult arena and start to replicate that now in the children arena. The children arena has done a huge amount of work about that, but one thing that has been lacking, and whenever I speak to people about that, tends to be they lack the intelligence, they lack the data, they lack that information. And that's a theme that has really benefited the adult arena and the work that we've gone forward. So can I put this down as an action, Chair, to say, yes, start to work this through for Wokingham and really support bringing up that children and young people agenda so they could truly and honestly benefit as well, not just from the adults arena.
Yeah. Carol.
Thank you, Debbie. I've just put in the chat box there, Katie, that I'd absolutely welcome a conversation with you about that.
Perfect, Carol. I'm going to do something. I was speaking to Nikki about it this morning, and I think we're going to do something collectively together. It'd be great to have you on board, Carol.
Yeah, absolutely. No problem at all.
Yeah, I just echo Katie. I think that's amazing. I mean, we've always said that in the Health and Wellbeing Board that we mustn't forget the children and their overlaps, obviously, with the Children's Board. So that's amazing. And you're right. We all have hearsay, or Mrs. So-and-so told us this, or my friend down the road said this, but with the evidence, that's what changes hearts and minds, and equally you can then track changes as you change things for the better for the people. So I think that will be amazing if we can, even replicate small amounts of that for the children would be incredible, because they are the adults of the future, and we need to support them, particularly with everything that's going on at the moment.
My own aspiration is the fact that, yes, we've done the work for the adults, let's start on the children. My aspiration, and I'm going to put it down now in the minutes, is to say that this time next year, I don't want us to be talking about children, young people. I don't want us to be talking about adults. I want to be talking as a household, because it's actually a household approach. You don't just have a children, young people, you've got to be influencing the adults that are also caring for them as well. So we've got to be thinking in that household conversation piece, but that's a journey we've got to take, I think, going forward. But household is my aspiration. If I can get this time next year, if we're talking about households, that'll be a tick box for me. It'll be brilliant.
Brilliant. Thank you. We'll hold you to that. So, Katie, you're going to briefly talk about the CCG operational plan, which seems like a lifetime ago.
It does. So I'm going to put myself on the screen. This is the actual CCG operational plan that was created back in March. That was then sent to NHS England back in May, June time. I'm just bringing it here, but to be quite honest, the whole landscape has dramatically changed. I'm just bringing it here for you to physically note, and I think everybody's priorities have changed as part of that COVID setup. But I want to give assurance that actually one thing that we have been doing is we've had to reprioritise some of the programmes of work that we had expected to do as part of that operational plan. But that was at the beginning of lockdown 1.0. I would say that we're in lockdown 2 now, going into vaccines. I would say that actually the work programmes and the priorities that are actually in the actual operating plan, we are still delivering. It might be slower than we expected, but we are still delivering. And that's all I was going to say about it, because I don't think there's a point of actually going through all the details, because I think things have changed dramatically in this time period. But I'm happy to receive any questions.
Any questions? David, you're very quiet. Are you sure you haven't got a question? No, thank you, Katie. So moving on to the health and wellbeing strategy update. Ingrid, is this you? Oh, sorry, I don't have a name who's talking to this paper.
Hi, it's Meriden here.
Oh, hi.
Hi. Hello, Debbie. I'd quite like to introduce it, if you don't mind.
Yes, great. Thank you.
For those I haven't met, I'm the Director of Public Health for Berkshire West. And Sarah Rayfield is here, and we'll talk through some of the details because she's been leading the work. I really just want to make a couple of opening comments about this. I think Katie summarised it nicely. The world has changed since this started and since you all agreed to the development of the Berkshire West strategy. And, you know, it's been over a year and life has completely changed. So the strategy needs to change too, and it has. There's a couple of reasons why it needs to change from what it originally set out to do. And you'll see that some of the metrics and some of the analysis has changed to go alongside this, and some of it's incorporated in the engagement piece. Firstly, recovery in inequalities as a result of COVID. That'll be the first one. The second one is I think the NHS is changing, and the papers from the CCG plan and the integrated care is moving much more, and we've got the National Integrated Care Plan now. It's much more about engagement, pathway design, and working across agencies. So the Integrated Care Partnership, which is the place at Berkshire West, is going to become more important. So this strategy needs to be seen in the context of driving the work of the Integrated Care Partnership, as well as driving the work of the Health and Wellbeing Board, and as well as being the place to go to for the police, for probation and other organisations in terms of driving health improvement. I think the other thing that really possibly needs to change is it's been called a joint health and wellbeing strategy, and I'm not sure the word joint is that well understood. It's not joining councils. It's not joining the NHS with the NHS. It is much more of a partnership. And I think the heading Happier, Healthier Berkshire is probably the best term for it, but it's much more of a partnership approach. And I think now the aim is, and I had a discussion with the Integrated Care Partnership about this as well, I think the aim is to get to a point where we have 3 to 5 overarching strategy statements, and then it's for each agency and for each health and wellbeing board then to develop their own priorities within those. And we think that's probably the way it's going to work best for the system and take account of all the changes around us. So I hope that helps in just giving some background introduction as to how it's changing to what people want and what might be beneficial for the public in terms of health and wellbeing improvement, which is what we're all after. So I'll hand over to Sarah to talk through some of the detail.
Amazing. Matt Pope's got his hand up. Matt, do you want to come in?
Yeah, that was a really helpful introduction there, Meriden. And in terms of the kind of local prioritisation key part of this, I know we've had some conversation about maybe having an informal board, could be in January, to kind of, for us all to kind of get a bit more sight of what that is and do a bit of work around that prioritisation. So I just wanted to kind of suggest that really and float that as an idea, because we haven't had an informal board for a while, and it might be nice to focus in on that and the kind of localness of the strategy, as you said.
I think that's a really sensible approach. We will have some of the results of the engagement, and there's lots of surveys and focus groups, and we'll be able to hear what the public is saying across the piece, and then we can have a discussion on how shaping those priorities can be relevant for Wokingham.
Katie.
Matt, I totally support you in that, actually having an informal board. I think that's definitely the right thing to do. It also ties in, as Meriden is saying, is to what is the next steps for integrated care systems, which has actually really made it quite clear about the actual role in the fact that it's creating a sort of a framework that the ICS supports places in a framework of superiority. So actually we've got to be able to deliver on a place-based functionality as such going forward. I think it would be really important on this is the fact that, are we doing it just in a Wokingham, or are we incorporating also Reading and also West Berkshire? My point is, I think we need informal at the moment in Wokingham, and then bringing the rest in, because I don't think we've actually necessarily had, have we ever had a joint health and wellbeing board? I can't remember actually. I don't think we've ever had one, have we? No, we haven't. No. Just think about it. I'm the longest serving health and wellbeing board member here. No, we haven't. We've never ever had one. But I think actually, Meriden, this approach, as you're saying, you've got to have that locality focus. You've got to have that unitary authority ownership as such. But we've also got to be doing it on a place-based conversation as well. So I'd be interested to see what people's thoughts are. I think we should have it in a Wokingham, but then plan out for a bigger health and wellbeing board down the line.
So can we ask to put that forward as the agenda item for January then, Madeleine?
No problem.
Thank you. Just thinking about kind of ownership, and I know that they're not entirely, on the membership for health and wellbeing, but if we're going to own something and discuss it, would it be worth considering inviting some of our PCN CDs to that meeting? It's just a question, but they're probably quite important. Or do we want to just keep it to this group and then ask their opinion later through our integration boards?
I know John's got his hand up, but I think that's a really good idea to get our PCNs involved in it.
So, Madeleine, can you send the invite to our PCN leads? Thanks. If you don't have them, if you contact Andrew Price, then he'll be able to give you their details. Sorry, John.
Just very simply, whilst one could get very enthusiastic about Bob, England, the world, we have struggled with our resources through this particular pandemic and the period. And I wouldn't want what we're doing to be watered down by our teams getting involved in other authorities, or our agenda to be driven by a common agenda. We should only do things collectively if there's something collective to be done, rather than trying to do it because there's some perceived merit. I'm really worried about Bob, the wider West Berks area and such like, because we are very, very different authorities. We have very different demographics, but it's also a matter of making sure that our resources, which are very limited, are used in the best possible way.
So to try and reassure you, John, I think Meriden explained it really well. Is, you know, whereas the group can decide kind of what the general priorities are. Absolutely, you know, we are Wokingham through and through. You know, if we're like a stick of rock, you know, it's Wokingham first. We're not going to change our priorities or our standards or share our money. So, you know, I think that's why also getting the PCN CD directors is when we've got the kind of steer about how we need to do things, undoubtedly we have to do it for Wokingham because we are completely different, and we've got even pockets within Wokingham that are very different, and we have to do things differently. So I would see, you know, the steer from the Berkshire West group, but undoubtedly we have to make it Wokingham specific. Katie.
I'm going to just back onto that, but I'm wondering whether or not in future we also invite James Kent to this meeting. He's the new Officer Chief Executive for RCCG, but also for Berkshire. I think it's worth, James, all going to be local. We are not going to, we're not going to water out that flavour at all. And that is, James has made it very clear he doesn't want to be doing that. He sees the real benefits of actually keeping this within the actual local authority area footprint. So I think it'd be worth inviting James.
Okay, thank you. So, Meriden.
Yes, if I could just pick up on John's point, I think you're absolutely right, John. It's about doing the right thing for the right population group. But I think I specifically only talked about the Integrated Care Partnership of Berkshire West, not the ICS at Bob, because I think what's going to be really important going forward is that we make sure we've got good collective direction for the Berkshire West system, particularly as we want to work with the NHS, plays such a big part in health and improvement across the board. So, for example, if we do have an overarching strategy, and it can be quite short and succinct, it will be just as important to drive the work of the cancer work, the maternity, mental health, and all the other parts, as well as driving the local priorities, which the Health and Wellbeing Board is so much better at doing, which is with communities.
Thank you, Sarah. Sorry, we're stalling your flow, but would you like to carry on? Thank you.
Yeah, that's okay. I mean, I can give a sort of brief overview of where we've got up to with the strategy so far. I mean, I understand, you know, there's obviously been this discussion happened already, so thank you for having me. As the presentation was given, we started the process by identifying some potential priority areas, and we did that by speaking to stakeholders across each of the three areas and by reviewing data on the population need. And we've now just last week started a piece of public engagement which will help us to then further refine them. And as Meriden said, the intention is that the final strategy will have around 3 priorities to focus on. The public engagement's been co-produced with a number of partners, including Healthwatch, Wokingham Involve, and then also members of the Wokingham Public Health team. So we've got an online public survey. We have focus groups that are targeted at more vulnerable individuals, including adults with learning disabilities, carers, and those from diverse ethnic communities. We're also hosting 3 public meetings, which will be held virtually in January, open to everybody. We've been in contact with chairs of voluntary organisations and also each town and parish council in Wokingham and across the rest of Berkshire West. We do recognise that the run-up to Christmas is a potentially difficult time to engage with the public. However, our colleagues from the voluntary sector were really keen that their organisations were given adequate time to engage and time to take the questions to their board meetings. And most of the groups and face-to-face face-to-face engagement will take place in January, along with further promotion of the survey. We also really welcome any comments from the board as to any other mechanisms we could use to engage with the public around hearing their voice and having their say in the development of the strategy. Our plan is to use everything that we hear from the public engagement to help finalise the priorities. And I really welcome listening to the discussion on population health management approach earlier, as we've been discussing this and how that will fit within the strategy as well. And we're planning on incorporating that approach and also ensuring that recovery from COVID-19 will be central to the strategy too. As we've discussed, we will ensure that although there'll be some shared actions and areas of working collaboratively across the West, where there's added value to do so, the strategy will reflect the population need for Wokingham and what Wokingham residents have told us as well. We're working closely with the public health team in Wokingham as well to ensure that the new strategy aligns with current priorities and the work that's been undertaken. And I think we've already covered this off, but I was going to say that we would really welcome the opportunity to discuss the areas at a future informal health wellbeing board. And in January, that would time well. We're working towards having an initial draft strategy available in March for comment. So that's a brief run through.
Thank you very much. Any further questions or suggestions, comments? No, thank you very much. As they having that meeting in January will be really, really well timed. So thank you. Berkshire West Safeguarding Children Partnership update.
Thank you, Debbie. So you have the slides in the pack. So I'm going to suggest that I share them. But I'll talk through them and then I'm happy to take any questions. So Sir Alan Wood was commissioned by the Department for Education to lead a review of the effectiveness of local safeguarding board arrangements and outcomes for children, and that review took place between January and March 2016. The review concluded that most safeguarding children's arrangements had difficulty demonstrating their value in improving the outcomes for children. So the Working Together guidance of 2018 replaced the local safeguarding children's boards with flexible, equitable safeguarding partnerships, which were being designed by the local authority, the police and the clinical commissioning groups, CCGs in health. So we have joined with Reading and West Berkshire. So we do have a Berkshire West Safeguarding Children's Partnership. It previously had operated a separate board since 2004, but we have come together as one arrangement. The new arrangements were agreed in March 2019. They're known as the Berkshire West Safeguarding Children's Partnership, and we had to publish those arrangements, and those arrangements were published in March 2019 and implemented in June 2019. The new arrangements are led by the statutory partners who have an equitable responsibility with commitment from the wider partnership. So what's different from the old arrangement? So the new role of the independent scrutineer is the difference between the old board being managed by a chair and having an independent scrutineer looking at all of our arrangements across all of our different aspects. So there isn't a board. There's an executive that meets 3 times a year, which I chair, and that is so that we can look at the strategic and policy aspects of safeguarding arrangements for children across the 3 areas. And then we have an operational group that sits underneath that, and we have independent scrutiny groups that sit underneath that. The independent scrutiny groups are all local. So there's a Wokingham Independent Scrutiny Group, there's a West Berkshire Independent Scrutiny Group, and there's a Reading Independent Scrutiny Group. And we also have 2 or 3 children's leaders forums a year. So that includes the wider groups that used to attend the safeguarding boards. There used to be sort of 80 or 90 people that used to attend the safeguarding boards. So they now come together twice or 3 times a year at a local leaders forum. And we've set up an education safeguarding engagement group in each area so that school leaders have a chance to directly feed into the safeguarding discussions, because the working together document does not stipulate that education as a statutory partner, which we don't as statutory partners agree with, but that came out in the guidance. So that's our way of working with our education colleagues. So what's the same as the old arrangements? So the same are that we still share the key safeguarding responsibilities, such as all the child protection policies and procedures and the child death reviews process across Berkshire, which we always did. We still think local, so within Wokingham, we have base subgroups and concentrate on those issues specific to our area. However, we're now able to share learning and good practice across the Berkshire West land footprint, as well as to discuss themes and issues that are wider than local borders. So, for example, county lines. So children being used to traffic drugs we know are not just in one discrete area. They travel across the whole of Berkshire, into London, into Surrey, into Hampshire, etc. So it helps us to identify those children most at risk. And of course, there's our police is Thames Valley Police, so it covers not Surrey and Hampshire, but obviously they work very closely with those forces, but it helps them to think on a wider footprint. The partnership remains passionate about improving lives for our local children, but with a partnership structure that can make it work for us all. So in your pack, you have got the new structure. So the new structure is that at the top of the structure, there's a Berkshire West Safeguarding Children's Executive Group, which is the group that I chair. We've then got an operational safeguarding partners, which includes head teachers, includes health colleagues, and includes assistant directors across the local authority groups. And then, as I mentioned earlier, we've got the leaders forum. Then underneath that, you will see that we have some pan-Berkshire subgroups. So that's the Child Death Overview Panel, Policies and Procedures, and Section 11, which is our collective safeguarding arrangements across the piece, and child exploitation. And then we have some Berkshire West only subgroups, which are the Case Review Group, Learning and Development, Section 175s, Case Communication and Engagement, Child Death Review Panel, and Health Safeguarding Committee. And then we have local subgroups. So we have, for Wokingham, we have an Independent Scrutiny Impact Group, as I mentioned. We also have a Child Exploitation Group. We have an Education Safeguarding Group, and we have Educated Designated Safeguarding Leads. So what have we achieved after the first year? So there are many positive elements to the new arrangements. Been excellent attendance and support from the wide range of partners, including the third sector with rich, sophisticated level of skills and knowledge, and comes together to promote and challenge in a safe way. Willingness to think differently has been a strength, even when partners have felt anxious, deviating from the old familiar format. The statutory partners are cohesive in their approach to making arrangements work and driving change to improve outcomes for children. I have to say COVID has absolutely brought the partnership closer together too. So we're even more close in relation to ensuring that as a system we work to ensure the safeguarding of our children. The partnership team support has emerged as a real strength in helping to steer the partnership on its journey and supporting the core business. Our partnership is committed to scrutinising our effectiveness and changing the arrangements if improvements are required. We met with Sir Alan Wood a couple of weeks ago as a partnership, and he was very impressed with our arrangements, and we will feature in his report that comes out March next year as a good model, because not all authorities have adopted the model that we have. The operational leaders group has been established at Berkshire West level to drive forward progress in the cross-cutting themes, and this group can add the context of how services work together, and the independent scrutiny function has been revised to provide a more flexible approach we've seconded somebody in from health, actually, who understands the local dynamics, while still allowing us to commission external scrutiny to demonstrate complete impartiality on specific pieces of work. And she's supervised by the adult safeguarding chair, so that we get some independence into the supervision of that member of staff. So what we have achieved is we've got a clear and effective rapid review process that provides detailed and comprehensive learning from cases at early stages, which has been recognised by the National Child Safeguarding Practice Review as best practice. We've got a new website for Berkshire West Safeguarding Children's Partnership that brings together all the key information from the previous local Safeguarding Children's Board websites and makes the location of information for practitioners and families clearer and easier to access. We've got a committed strategic partnership that ensures the best plans are in place to identify and respond to risk and help our vulnerable children. particularly during COVID. We've got locally devised Be Brave, Speak Up online campaign, which reached 81,824 hits with an expression of interest of 522,445, being watched an average of 6.3 times and shared 207 times on Facebook. We've got free access to online universal safeguarding training that's been created locally and made available on the website for all partners to access, particularly welcomed by our education community. We've got local learning and key information from serious case reviews and delivered to 167 practitioners opportunity to participate in multi-agency safeguarding discussions. We've reviewed our thresholds and levels of need documentation across Wokingham, West Berks and Reading. This has led to a revision and the production of a new aligned threshold guidance in each area. There is still a Wokingham document reflecting our local processes, but the 3 new documents use similar language and have a similar approach, look and feel. This is a huge step forward in supporting all of our practitioners to understand when and how to make a referral to any children's services across the footprint, and it's been agreed and will be launched soon. Partners have said it makes their life so much easier because we've got children who live in Reading but go to school in Wokingham, who live in Wokingham but go to school in Reading or West Berks. So we cannot help but we are a community across that West Berkshire footprint. So we think that that will be hugely advantageous to our partners in helping them to understand how to access that specialist support when they need it from the Children's Services safeguarding departments. I'm happy to take any questions.
Thank you. Any questions? David?
Sorry, I just wanted to, I mean, you mentioned COVID several times, but you never said the effect that COVID has had. And I mean, I don't know, it's certainly had a negative effect on mental health and I presume domestic abuse. And has it had a negative effect on safeguarding in that way?
Oh, the truth is that we don't know yet, David, because I think children will be the last, apart from babies, where we've had an increase in non-accidental injuries of babies during the first lockdown of COVID. But the impact on children's emotional and cognitive well-being and development, we won't know for some time. But there's a number of research projects that are now being undertaken to ascertain the impact of COVID. And Ingrid and I are working quite closely, Public Health and Children's Services, working quite closely to really understand the impact of COVID on what that might mean for us in terms of delivering services in a particular way. The main safeguarding issue that has come out nationally is the increase in non-accidental injuries of very young babies and children under 5.
But in some ways, it might have a longer term effect.
I imagine it will.
It'll be months and years in advance.
Yes.
That will be the negatives.
Yes, and that's what we're looking to try to do some horizon thinking around what that might be in terms of the impact of anybody in that kind of 0 to 25 cohort that has been impacted by COVID, and there definitely will be some impacts. We just don't know the full extent of them yet.
Exactly what it will be, but thank you.
Yeah, well done. I mean, it's an amazing achievement, and as I say, to kind of have some alignment, and I think as clinicians, having some of the learning from the case reviews is invaluable and just makes you think differently about things. So thank you very much. And I think, David's right. We're not going to know everything, and I understand obviously about the babies initially, and again, the teams worked very quickly to support that and got messages out to form bubbles, which was against the national advice at the time, to support those new mums, particularly with an under 2 already at home and potentially an under 2, and the fact they had their husband there as well. But I think also perhaps that Be Brave, Speak Up. We may have to think about how do we run that again. I think with with everything's going on, we're in lockdown, out lockdown, we're half in it and half out. And now we're going to start seeing people being made redundant. Families are going to be on increased amount of pressure. And it's just a boiling pot waiting to happen, isn't it? So I think, that Be Brave, Speak Up. People just looking out for each other and other people's kids. is invaluable. So whether we just think about how we get those comms out intermittently, I think, isn't it? If it's there all the time, you become a bit nose blind. Yeah. But if you drop it in from time to time, it has more impact. And it's a very sensitive issue, because what we don't want to do is increase risk to families by overly intervening. So the police have been running a campaign in relation to domestic abuse, for example, where they've gone to families that they've had previous referrals to, just to kind of do a bit of a welfare check. But there's always a fine balance between, are they going to put more pressure on the family by doing that rather than not doing it? So they've increased their campaign around, we're listening, we will prosecute, all of those key messages around families living with domestic abuse. But it is a very fine line we walk in relation to safeguarding, not tipping any family into a greater kind of period of risk, really. So, but the partnership are working really, really well together, and we've got a COVID partnership group specifically looking at how we address the safeguarding issues moving forward. So we meet fortnightly, continue to do that. Great. Thank you for all your hard work, and thank your teams as well. Thank you. Thank you, Debbie. Director Public Health Annual Report.
Thanks, Debbie. I'd like to introduce this, please. I hope that many of you have had a chance to read this report. It is entirely on recovery. Bearing in mind COVID and the impact on society. So what we've done is we've looked at evidence on disasters all around the world and how they might help us, in identifying some of the problems we're likely to encounter, but also some of the solutions. So, for example, you'll see some solutions and insights from the Ebola outbreak in Africa, the Grenfell fire, Australia bushfires, and various interventions. So I would encourage you to read it, and I hope this will be a reference document that people keep referring to and use. In the development of priorities around the health and wellbeing strategy is just one. So I think just highlighting a couple of pages for you. On page 118, you'll see there's a nice picture, an infographic of all the problems that we're likely to find as a result of the pandemic. This is only good as the baselines that we identify and be able to measure change, but also the solutions that we apply to them. The next few chapters are about, a lot of it is about the problems that we're going to find, more morbidity, more illness, more mental health, that kind of things. But what I'd like to pick up on is page 121, for example, looks at employment, and you'll see there the different economies and the percentage of different parts of the workforce that use the furlough, and also the numbers of increase in people applying for unemployment benefits. What's really interesting is the accommodation and food industry is by far the largest in Berkshire in terms of people who applied for furlough, and that will be an industry that will be hit the hardest in terms of recovery, and some of it may never recover. So I'd now like to maybe talk about the last couple of chapters. On page 154, what the resilience and social cohesion chapter talks about is, rather than focusing on problems, which is important to do, is think about community assets. What are the assets we can use in recovery, and how can communities do it for themselves? This isn't all about us finding lots of money and doing lots more things to people. I think Carol just alluded to that when she was talking about children and families, is how can we enhance people's abilities and communities to do things for themselves. And then the last chapter is, how do we measure a change? And this isn't about measuring how many problems we've got, how many more mentally ill people or how many less. It's about how do we measure the assets in society. So it's a different and more positive way of measuring change in a society. So I'd just like to promote this and hope that it'll be used as a reference for the system. And I'm sure in the future we'll come back to it, and various parts of it I'd like to be able to present how we're progressing. So thanks.
Thank you. Any questions or comments, Katie?
Meredith, I think a really, really great report. I think it actually gives us an overview of those challenges going forward. I'm just wondering how are you bringing this up to the CCG governing body, to the ICP Unified Executive, because I think they need to see sight of it as well, Meredith. That'd be very helpful. But also, I'm reflecting, and we all get into a vaccination conversation at the moment, but I do think we've got an opportunity. If you take your public health report, the whole of the country is going to be vaccinated, and they're going to have 2 points when they're going to be touching individuals. It's going to be very hard to do, but I do think actually having those, almost that approach of making every contact count at those specific points is going to be quite a vital thing. And I don't want us to, I'm really wanting to explore that potentially about how we could do that, but not necessarily putting enormous pressure on those actual sites going forward. But this is an opportunity, I think, where we could really truly make a massive, massive difference and take that public health, your report, and actually make a big difference going forward. You're on mute, Meredith.
Must have done it herself. I'd be very happy to take the report to the ICP and the CCG, bearing in mind the focus on vaccination at the moment.
Yeah.
Thank you. Any other questions or comments? I say, yeah, it's great to see that and an easy read, and the diagrams are just hit you and make sense immediately. So well put together. So thank you very much, and thank Tessa as well, whose face is on the front of it. So that's great.
Of course, it's her report.
Yeah. So moving forward to the.
I think you've got a hand up. You've got a hand up.
I missed one. Sorry. Susan.
Oh, hi. It was really to say thanks very much for all the work that you've done on this, Meredith, because it is a clearly written report to say thank you very much. And I wondered, and I was reflecting on the point that Katie made earlier on about population health and the fact that we focused on adults when we're moving to children, and that need to focus on families. And I wondered whether there was a connection between the points that Katie had made earlier and then the recommendations that have come out of your report in terms of approach that we might take.
I think there are a lot of community asset type family indicators that can be used, and it's a measure of how healthy a community is as opposed to how sick a community is. Mm-hmm. And that's the asset approach. But the other one on the economy is the density of employment, not just how much money that comes into the borough, for example. So there are a number of indicators that are more about this, and the social economy is another one. The social economy, and there's a huge amount of social economy working in children's services, for example, and that's all your voluntary sector use, social enterprises and those. So the answer is yes, there's quite a lot actually that could look at the health of families.
Okay, thanks for that. That's helpful.
Katie.
Just building on that, thank you so much, Susan. Building on that, Carol, do you have that information to hand at the moment? And is that information that you're able to break down onto ward levels yourself? And just inquiring, because I think we can start this conversation. You're heading, you're nodding, you're not really. I think this is what this is a celebration. If we can come back next year, this point, and I ask the same question, and Carol goes, yes, I have, and actually I've been able to do this, and this is what we've actually been able to work on. I think that's what we'd get success on.
So I had initial conversation with Ingrid and with one of our members of staff that works in our digital teams to have a think about what we could do initially in the new year anyway, just to have a look at. There's a lot of information and a lot of data there that we don't have access to. And it's how we get access to it and make it meaningful. and then put it into what does that mean in terms of service delivery and service design and service delivery. So there's definitely some work for us to be able to do, and now we've now seemed to have more than we've ever had. So that's really good. It's now making sure that what we've got is meaningful, and that we don't get overwhelmed by lots and lots of data, but that we just take what's really useful and we design our services around that. So I'm looking to do a pilot probably in the new year with some of the information that Ingrid shared at our Gold meeting this morning. So yes, absolutely. And I've just asked Ingrid to send me the individual report that you're presenting now, Meriden, so that I can have a proper read of it in full. And then we can take things from there. But I agree that if the Health and Wellbeing Board was approaching the whole lifespan, we wouldn't necessarily have to have a Children and People's Partnership Board. But the partnership at the moment feel that it's not strong enough in relation to children, that we have to have an additional layer, which is not necessarily helpful if we could address everything through this board.
Okay, thank you. Something to work on over the next year. So any other questions on that? Hi Charles, I note that you've arrived. So I'm not quite sure when you arrived. So the last agenda item is the forward programme. But before that, Charles, before the meeting, had asked Katie and I to give the board an update on COVID-19 vaccination programme. So it's a little bit hurry up and wait. So I did a site visit to one of the vaccination centres this morning, which is kind of good to go. There's a few things that we are waiting on, just practical things like the fridge to put the vaccines in. Katie and her team are doing a sterling job about organising all the IT and stuff that needs to go in to make this happen seamlessly. The practices are already contacting their over 80s to get them down for the vaccination programme. As you're aware, we have to do vaccinations 21 days apart. So those patients are being booked an appointment and for 3 weeks' time at the same time. The only hesitancy we have with that is that all those patients are saying, yes, you are on the list, we want you to come down. But the day may change because obviously until we get the vaccination physically in our buildings, we cannot do the vaccination programme. I'm happy to share that our first wave in Wokingham is actually going to be in the north. So that it will be actually physically held in Wargrave Surgery with Twyford clinical staff, HCAs coming over to do some of their patients as well. And we've also got clinicians coming over and admin staff coming over from Loddon Vale and from Woodley Centre in smaller numbers for their patients to start that service hopefully next week. But as I say, I can't give a definitive date because until we've got the vaccine in the building, we can't do that, but we are good to go. We are going to do site visits. I'm going to do site visits next week for a few of the other areas as well. But again, I can't say where and when because again, it depends on when the vaccine is coming into the building. There is strict national guidance, as you can imagine. This is like gold dust, this vaccination, and not a single drop will be wasted. So we are doing in strict rotation. So it's the over 80s who are physically able to get to a practice. We are asking, and again, when I was at the Wokingham PBG, I gave the same message. If you could, tell the public not to ring practices, to ask for it. We know where you are, we know where you live, we will be contacting you. And unfortunately, if everybody swamps the practices asking when they're going to get their COVID vaccine, one, we can't give the definitive date, and it actually just blocks all the phone lines, so those people with an urgent medical need may be put at risk. People might think, oh, if I nip down with my wife, she's over 80 and I'm not, can I have the vaccine? No, you'll be turned away and you will be called when it is your time to come down. Obviously, again, this is a marathon, not a sprint. As different vaccines come on board, then we will kind of change some of our processes and be able to get out to different members of the public. But at the moment, we've got the Pfizer vaccine, which is what you've all probably heard about in the news, which needs to be at -70. And then we've effectively got 3.5 days to deliver the vaccine before it is no longer useful to us. David.
Before David comes in, can I just give a bit more
context? Yeah.
So basically, as Debbie was saying, it's such a movable feast. I mean, today I have just been in and out of calls and things are changing on an hourly basis, really. But to just give a summary, there are 3 main delivery channels that will actually be utilised for the vaccinations. The first, as Debbie was saying, is leveraging primary care. And what we're doing is extending the actual approach that we've taken forward as part of, for example, the flu vaccinations. The second is that the work of the providers, so for example, that would be in relation to the Royal Berks and Berkshire Healthcare Trust, they will look to work with vaccinating their own staff. So I must admit, I had my flu injection on Wednesday and I was speaking to the nurse who gave my flu injection, and they're ramping up and hopefully starting that as soon as they get hold of the vaccines. The third area that's been worked on, and I think Susan will be able to, or Matt will be able to talk about this also, is that we're working with our local authority colleagues to looking to establish a small number of potential mass vaccination sites. There is some talk about that at the moment. I don't know whether Susan wants to announce that at the moment, but I don't really want it to go out into the public because I think people will start to think that they go to that site and just be vaccinated. To give updates on the PCNs, what happens here is the fact that there are 10 PCN sites that are happening across Berkshire West. There are actually 5 sites that are actually in part of Wokingham that are going to deliver those actual sites. I think it's fair to say I can announce that first wave 1 site, Debbie, if you're happy with me. But that's going to be in the Wargrave area. It's not the Wargrave, that whole Wokingham North area. They've separated out their sites. So they're only going to take the Wargrave area. And I've literally just had Dr. Jim Kennedy email me, basically saying to me that actually they're writing out to all of the over 80s to actually get those people supported. But they're waiting again for fridges. They're waiting for the IT quick kit that's actually coming to them on tomorrow. But most importantly, they need the vaccinations. Everything is very much dependent on when they get hold of their vaccination. But it's hoped that they will kick off early next week. Other sites will then go live, hopefully at the later in that week, and then over the course of Christmas and starting of January as such. But we will start to provide further updates of this going forward. Susan, is there anything you wanted to say about the mass vaccination site? Because I'm not too sure whether or not you want to mention it at all.
I can't add any more to what you've already said, Katie, in terms of mass vaccination sites. I've got to say, but I think you gave a sort of really good update then in terms of, how quickly things are changing in terms of vaccination sites for sure. And it's a regular item on our sort of gold meetings, COVID gold meetings. But yeah, I haven't got anything to add to what you've already said, Katie, at this point of time.
So, David.
Yeah, I just want to add one thing, and that is that care homes were going to be, yes, top priority to vaccinate. But in fact, apparently the vaccine is too volatile to take to care homes, and therefore that isn't somewhere that can be vaccinated at the moment. But hopefully in time, another vaccine will be available for them.
Yeah, just on homes, exactly that, David. If we ever get the go ahead that we are allowed to transport the Pfizer vaccine, then undoubtedly we are going to be straight in there particularly with Twyford and Walgrave, despite not being able to get into nursing homes. They're kind of moving hell and high water. So if any of those people in nursing homes can physically get down, or their carers can get down, they are still vaccinating them. And our carers in the nursing homes are also being vaccinated, actually ahead of healthcare workers, which I think is only right.
Yes.
So certainly in my own area, they are going up to Oxford to have their vaccinations. So we're kind of getting everybody through the gate. It will take a bit of time, but rest assured we will get there. All the practices are signed up to deliver this, and work at beavering away behind the scenes to make sure everybody also remains safe. And the other thing, if you do come into contact with people that are saying, what's happening about the vaccine, the other big thing that again only changed yesterday evening was following that some people have had allergic reactions. All people will be expected to stay after the vaccine for 15 minutes. Now, every practice or every area is handling that in a different way. Certainly Walgrave will be shepherding their people with the support of their PPG and clinicians into Elizabeth Court, so people can be socially distanced but can just wait to make sure they're not having a reaction before they go. But other practices are going to handling that very different way, so be guided by what your practice tells you. But you will kind of be booked in, have your jab, and expected to hang around for the 15 minutes. John.
And also, can I just say, it's also people with EpiPens can't have the jab, because it was people who have used EpiPens who had the allergic reaction.
Yes, definitely.
One thing I've just literally enacted is the primary care, the prescribing team are giving a list out to all of the practices to flag up those people that have got EpiPens. What's going to happen is, which I've just literally ordered whilst I was on this call, is that you are going to get, all the people are going to get text messaging to allow them to book in. So it's going to be, you're going to get a text message to notify you that you're going to be actually you've got an opportunity to go for an actual vaccination site. But it's going to be a drawn out process. But the sites also will start to know about those people that have got a severe allergy. And actually we're trying to record those people and identify those on the practice system to say those are red flags and those people should not be invited, or they could be invited but they've got to have a clinical assessments beforehand.
Sorry, John.
Just a quick thing. Could you make it clear, very clear, that the selection of Walgrave as the test site is not to do with the fact that it's my ward? I have had nothing to do with it.
No, we were going to put them bottom of the list because it's your ward, but somehow
it was the CCG.
Yeah.
The CCG.
Very embarrassing.
So I'm sure you were in the beginning as well, so don't worry, John.
Yeah.
You're not over 80 though, John. You won't be invited.
Oh, you won't be done till Easter, John. You're on the shelf. Sorry, Charles.
No, I'm just going to say thank you very much for that, and also thank you for doing the meeting for me tonight. My apologies for being late. All I was going to say was that was very helpful, and I've had probably 7 or 8 emails from people this week asking this question. There's obviously a thirst for knowledge on it. I'm sure you've both had a lot more, basically, but it was just if you could keep us informed of things as and when they develop, so we know what responses to give out to people.
Yeah, we can do that. That's fine. Thank you. Thank you. Martin?
Yeah, I was just going to update as well. We are working with some of the clinical directors to see if we can then provide volunteers to their sites, especially if this is going to last a number of months. So we're working with Wokingham Volunteer Centre, and they are out actively going to recruit volunteers and then try and then get them to the sites who need them. So we've already agreed with Early Plus and with PCN East to provide volunteers to both their sites to sort of marshal in and out of the building. So we are working on that in the minute.
That's really kind. Thank you so much.
If I could,
Sorry, John.
or Katie, just to add, Martin, we are holding an executive meeting next week to authorise the funds to support that exercise.
Thank you.
I think this is what I was saying earlier on. I think actually this is it's a massive undertaking. It's the biggest thing that we've ever done. But actually, it's an opportunity, and actually having that volunteers is going to be, I think, vital. I think what we could do here is, if they are working within those sites, alongside those sites, having volunteers that may be trained in mental health first aid, because people might be flowing in and might be actually then thinking about what their own mental health status is, but also at making every contact count approach is going to be so vital. So I really want to get training for making every contact counts for those volunteers as well, Martin, if possible.
Can I come back on that slightly, Katie? So yes, whilst I agree and I'm happy for people to just check on people, and obviously that's what we're doing in that 15 minutes post to make sure that people are clinically safe. This is an environment where we need to reduce contact actually as much as possible, and equally with the sheer numbers that we have to go through. Like all of you have been to just a normal flu clinic, you know, it's not a tea and cake service, you know, it's have your jab out because of the sheer numbers. So whilst I would agree with you on every other occasion, Katie, I think in this situation it's a little bit more difficult to stand around and chat.
I'm not talking about chatting, making every contact counts is literally a 2-minute conversation, but the volunteers are there. If they're outside, then that's great and such, but
yeah,
we'll work it through.
Yeah.
Great for challenging me, Debbie.
Thank you. So
we had envisaged that we would be supporting on the marshalling only from a borough council point of view.
Yeah.
And I think that if we pretended to be medical staff or anything else, would be doing a disservice.
Yeah, our focus will absolutely be on the marshalling and getting them in and out, and the 15 minutes after, as Debbie has said. And I think that's the key focus, because this is going to be, like, the numbers are huge, so this is going to run for quite a few months. And we're going to have a lot of volunteers. So I think we're just going to have to be practical about what is doable.
Yeah. And it's great that we've got a number of volunteers supporting, as you say. You know, it's not, you know, if we were going to do everybody in a month, everybody could go hell for leather and work all the hours God send to get through these people. But this is going to go on for several months. So having a number of people that we can call on to help means that we help also look after the well-being of all our staff and our volunteers as well. So yeah, thank you so much, the voluntary sector, for supporting us with this. So going back to the agenda, so the forward programme from June 2020, there's not anything on this as such. Am I missing something, Madeline?
No, that's the forward programme. So it's a rolling forward programme. It started in June 2020. So it's just for the meeting in February and the one after that. If anybody had anything that they're aware of now that they need to add.
Anything needed to be added? Okay. Thank you very much. I feel as though I whistled through that really quite quickly. I hope people had a chance to have their say on any items that they felt were required. Charles, I know you came in late. Was there anything else that you wanted to pick up during the meeting?
No, not at all. I mean, I think the main thing for me was the bit we did at the end, which was updating people basically on the vaccinations, which is the subject of much discussion, and just maintaining forward progress on everything else. So thank you very much to everyone, and thank you again to you, Debbie.
Thank you. Thank you.
Thank you, Debbie.
Yes, so we won't see each other before, so have a great Christmas. Many thanks. Thank you.
Thank you very much. Thank you.
Yeah, happy Christmas, everyone.
Bye.
Bye.